As mentioned, since last year I've been the president of the Irish Epilepsy League, which is the Irish chapter of the International League Against Epilepsy. And so this is our logo here on the right. It's our new logo from last year. So this was designed by Dr. Amre Shawan, who's a pediatric epilepsy specialist in Temple Street. So kudos to him for creating a very nice new logo for us, just so that you're familiar with that. So I'd just like to introduce you, for those of you, again, not as familiar with the International League Against Epilepsy as opposed to the IBE, which Epilepsy Ireland is part of, although, of course, we're sister organisations. And I've just taken this from the ILE website, and it's the world's preeminent association of healthcare professionals and scientists working towards a world where no person's life is limited by epilepsy. So that's the goal of the ILE around the world. And there's over 26,000 members. So, and the reason why I put that there is because if you think about it, isn't it great that there's so many thousands of doctors, nurses, researchers all around the world constantly working to, try and improve the treatments and improve the lives of people with epilepsy. So the specific goals are to serve health professionals as a primary international resource for current and emerging standards and practice. So, that means that, they'll come up with guidelines that will be followed, in every chapter generally around the world, including Ireland, to support health professionals worldwide to enhance their knowledge and skills in epilepsy. So it's very involved in training doctors, training nurses in how to diagnose and treat epilepsy. Because what we need is young people to initially go into, say, nursing or medicine or psychology, and we need them to get interested in epilepsy because we need them to then go on and develop careers in epilepsy, so that they can then in turn benefit everyone, either who has epilepsy or involved in the care of people with epilepsy. And that's not always easy. So a big role of the ILE is to advocate for epilepsy as a public health imperative, as does Epilepsy Ireland, and to promote research and innovation for epilepsy. We always need new treatments. We're always looking for better ways or newer ways to improve our means to diagnose and treat epilepsy. And the current president of the ILE, so you're aware, is Professor Helen Cross. She's a very well-known world expert in pediatric epilepsy, based out of London. And a new president is elected every 4 years. And the ILE then itself is independent and having its own constitution and governance and finances, and they have advisory committees and task forces to look at various aspects of epilepsy that need closer looking into. So, for example, I'm on the surgical therapies task force, so we look into areas around epilepsy surgery that need more attention, and looking forward and planning over the next couple of years. And we're funded from the ILE is funded from membership fees, it has its own journals, so it has some income from that, from the conventions and conferences it holds, and from charitable donations as well. And fortunately, it's in good financial health at the moment. And there's a strategic plan, just so you know, that the ILE, we're always thinking ahead, or they're thinking ahead, and there's a strategic plan to make sure that things are kept going and in good financial health in the coming years. So just again, some information about the Irish Epilepsy League then. Now, this is the Irish chapter, so each country has a chapter of the ILA. So the Irish Epilepsy League is the Irish chapter. And this was initially formed in the 1990s, and Joe McMenamum and Deirdre McMacken were very involved in the setting up of the Irish Epilepsy League at the time. And then for many, many years, Professor Norman Delante, who many of you are familiar with, was the president of the Irish Epilepsy League up to 2017. And now we have kind of 4-year terms, like the main ILE, so from 2017 to 2021. Danny Costello, who's an epilepsy specialist in Cork, was the president, and he's still on our committee. And during that time, we achieved kind of a major goal of ours, which is to become a sort of separate legal and financial entity. So that means that we have it will help maintain our long-term financial health and our long-term health and governance and finances. And during that period, during that 4-year period, 2017 to 2021, Amaray Shawan, who created our logo, and Peter Conarans and JP Cavalieri were part of our council, and many thanks to them for all that they did. So, just so you know what who our committee is at the moment. So I'm the president. Danny has stayed on the council as past president. Jed O'Connor is our secretary. So he's a neurologist in Waterford and Cork. Olivia Mahoney is our treasurer. She's a paediatric neurologist in Cork. And Christina Reski is we have a research representative to represent research around epilepsy, and from RCSI. And over the next couple of years, as well as the conference that we just had, we hope to continue to help provide training and education resources for doctors, nurses, others around epilepsy, to advocate for patients. So, for example, earlier in the summer, we sent a letter along with Epilepsy Ireland to the Minister for Education regarding the Leaving Cert students who had seizures during their exams. So we hope to continue to, along with Epilepsy Ireland, advocate for our patients. And we also want to develop a website as well, which we never had before. And this is actually, we have a very basic website then that's just recently come online with, again, very basic information, but we hope to kind of expand that information over the next coming months and years. So it's www.irishepilepsyleague.com. Much more basic than the fantastic Epilepsy Ireland website. So one thing I just want to highlight, and you may know of this already, and there may be I'm not sure if there's a talk on this, and I highlighted it at our meeting as well last week, is this intersectoral global action plan on epilepsy and other neurological disorders. So I don't know if anybody's heard of this. Hands up who's heard of it. So just a couple of people. So this is a major health initiative that had a lot of input from both the ILAE and the IBE as well. And the idea is that, neurological disorders, particularly epilepsy, because it's so common, there's a huge burden of disability and mortality around the world. But it's under-resourced. We don't get resourced the same way as, say, cancer care or cardiology care. And, there's not a lot of research euros and dollars going into epilepsy as those other areas. So, and there's still big gaps in epilepsy care in countries around the world. So this is a major kind of action plan that was actually approved eventually by all the WHO World Health Organization member states back in May of this year, including Ireland. So Ireland signed up to it as well. And the idea is to produce a standardized international action plan to guide countries in their national policies, provide a framework for best practice and access to epilepsy care, to promote brain health across the lifespan, to reduce deaths and disability from epilepsy, and to address stigma and discrimination and promote human rights in epilepsy. So you can sort of look this up online and look at it in more detail, and it has particular strategic objectives and targets, but say one, for example, that I'll highlight here is strengthen the public health approach to epilepsy. So one of the targets, again, that all these countries, including Ireland, have signed up to, is that countries increase their service coverage for epilepsy by 50%. So, wouldn't that be great? And that 80% of countries will have legislation promoting the protecting the human rights of people with epilepsy. So, wouldn't that be great as well? So hopefully the Irish government will follow up, and I know that that Epilepsy Ireland has already written to the Minister, I don't know where Peter and Paddy are, but they've already written to the Minister about this, saying, what are you going to do? You've signed up to it now, what are you going to do? And I don't know if you've had a response yet. Not yet, so yeah. So hopefully there will be a response soon, if not, we better start writing more letters, raising the profile of that. And in particular, the ILAE and the IBE have promoted this target as part of the plan. It's the 90-80-70 plan for epilepsy in terms of trying to reach these targets for epilepsy in the next few years. So that is 90% of all people with epilepsy are aware of their diagnosis as a treatable brain disorder. And remember, this isn't just Ireland, this is in every country in the world. By increasing public and professional awareness about epilepsy, by improving diagnosis through training and network, that harmful myths are replaced with an understanding that epilepsy is a treatable brain disorder. So, it's still a problem here in Ireland, but, it's also a problem in many countries around the world as well. And the idea is to kind of close the treatment gap, or close the gap between epilepsy care that exists between third world countries, middle income countries, high income countries. So the 80 then of this plan is that 80% of people diagnosed with epilepsy will have access to appropriate, affordable and safe anti-seizure medications. And you may think that this mightn't be as much of an issue in Ireland, but we were just chatting earlier about Rivotril. There's a shortage of Rivotril. People can't get it at the moment in Ireland. So, but it can be a big problem in other countries as well, supply chains for medications. And 70% of people with epilepsy on treatment achieve adequate seizure control. So we think that is a target, for the WHO, the World Health Organization now, and all the countries who've signed up to it. And by investment in primary and community care and support, by empowering people with epilepsy and engaging them, and continuing research to improve treatment options. So hopefully Minister Donnelly will read the letter, or has read the letter already, and hopefully they'll have some kind of plan to implement this as they've already signed up to. Another update from an ILE point of view, just briefly mention that the ILE has been trying to support health professionals and patients with epilepsy who've been affected by the war in Ukraine. And here you can see there's a number of steps that the ILE has taken in order to try and support in terms of supplies of anti-seizure medications, supplies of rescue medications. You could imagine a patient with epilepsy in Ukraine where suddenly there's no pharmacy there anymore, there's no hospital there anymore, there's no place where you can get your medication or your buccal midazolam, So, just a number of steps here that you can look in more detail here on the website. One of the steps we took earlier in the year was to send around, and Epilepsy Ireland helped us with this as well, but to send around linguistic aids of common epilepsy terms that we can translate from Ukrainian or Russian for refugees that may be showing up in our hospitals or clinics or around the country, in order to improve communication. And we sent around to every doctor or nurse treating epilepsy around the country some tools to help with that. And I just wanted to highlight the training that the ILE offers particularly to young doctors and young trainees. As I mentioned, we don't have enough doctors and nurses that are trained in epilepsy care and are working in epilepsy care at the moment. And it's always a challenge for us to try to get people interested in it and try and promote their careers so that, they will then go on to a career in epilepsy care and, stay in Ireland as opposed to go abroad. So the ILE does help in terms of providing some training resources and journals and curriculums, that we hope will eventually result in more nurses and doctors that will be able to care for people with epilepsy in Ireland. And just to highlight another few new activities of the ILE, or new components of the ILE, we have a new nursing section in the ILE. the International ILE, that is, where now for the first time there's a formal organisation within the ILE for epilepsy nurses. And of course, we all know that epilepsy nurses are one of the most, if not the most important aspect of our epilepsy services around the country. And this will provide a communication platform for them, develop educational curricula and continuing professional development for them, and encourage their participation in committees and guidelines and conferences. And so I know that the epilepsy nurses in Ireland are very interested in becoming part of this. Another aspect of the ILE that's new that you might not be familiar with as well is that the ILE also have what's called a young epilepsy section, where again we're trying to encourage young people and give them supports for their career in either their clinical career in treating patients with epilepsy, or in their research career where they're trying to research new ways of diagnosing and treating epilepsy and supporting that. And just to highlight some new initiatives of the ILE and that have just started and will continue over the next few years. And this is just to mention, as many of you already know, that the big conference for the ILE is in Dublin next year. At this point next year it'll be over, so it'll be the beginning of September. So this is held every 2 years. And, basically, a lot of world experts in epilepsy will be gathering together in Dublin for this conference. And the last time it happened in Dublin was in 1997. So it's a kind of a once-in-a-generation conference that will happen in Dublin. So we're excited about that. We're hoping there will be some patient participation in the conference. So if your doctor asks you, would you like to participate in this and or help us with this, I'd encourage you to do that. It's a once in a generation opportunity. So for the next part of my talk, I just want to give you a few highlights from our conference from last week. I know a couple of you from Epilepsy Ireland were at the conference, and Paddy gave us a great update on the activities of Epilepsy Ireland. But I just want to give you a quick overview of what we talked about. It was in the Gibson Hotel, so as you know, it's also the venue for a well-known TV show. So although we didn't get to meet him, but we did cover the cost of the lunches. We didn't split the costs or anything. So, but it was a great venue. We had a nice room overlooking the port, and everything went well on the day. So I'm just going to give you an overview of what we talked about during the meeting. So our first keynote speaker was Professor John Higgins. Now, he's not an epilepsy specialist, but he's an obstetrician in Cork University Maternity Hospital, and he's not only the clinical director of the service, but he's also the CEO. So he not only he was telling us that has great advantages. You not only know what's needed on the ground because you're actively there treating patients. You're also the CEO and make decisions about what needs to be done and taking action and making changes. It's probably something that should be replicated around the country, and perhaps we'd have better health services. In fact, I know we would, So, and they've really been revolutionising care at CUH Maternity. It's a fully digital hospital now, and with an electronic patient record. So, and in fact, every time there's a person with epilepsy who's in the hospital, and every time a doctor logs into their electronic record, it'll flash up if they have epilepsy. This patient has epilepsy, so that every person who logs in, or every doctor or nurse who logs in, is reminded that this patient has epilepsy and needs additional attention to that. And a large part of his talk is about maternal mortality, and many of you may know that there was a tragic circumstances a couple of years ago where a woman with epilepsy died after giving birth. So having a fully digital hospital with electronic patient records like that, will help prevent that. He gave us an update on what's called the Embrace report, which is a UK report which includes Irish data, that comes out every couple of years on maternal mortality, and the neurological mortality is the second most common cause of mortality in women who are pregnant. And in fact, epilepsy is the most common cause then within that neurological mortality. And a lot of that is SUDEP related, or sudden unexplained death in epilepsy. And interestingly, they found that, and they're not exactly sure why yet, it seems to be women in the first trimester. They kind of thought, well, maybe it'd be more likely to be women in the later stages of pregnancy or around delivery, but in fact, the higher risk of mortality is in the first trimester. Now, thankfully, it's very, very rare, but still too common, So they're not sure whether this is maybe it's women are kind of afraid to take anti-seizure medications, in that first trimester, where potentially there's more risk of it affecting a developing baby. But on the other hand, a woman could die from her epilepsy during that time as well. So we don't really know yet, and there's hopefully more to come on that and more research. And he highlighted the need for more neurologists and epilepsy nurses with a maternity commitment, because it is a high risk pregnancy of a woman with epilepsy is pregnant. And so now for the first time, Jed O'Connor, our secretary, has taken up a post with a 50% commitment to the Cork University Maternity Hospital. So that's the first in Ireland for that. But he feels really need about 5 posts like that around the country, because they have about maybe 20% of births, down there. So they want to increase that coverage of kind of more neurology epilepsy care to about maybe 50% of births in Ireland over the next maybe 5 years. But, it really needs to be all around the country. So our second keynote speaker on the day was Professor Aileen McGonagall, and she came to us all the way from Brisbane, Australia. And now she's actually Scottish, but and spent a lot of her working life in Marseille, actually, because she married a Frenchman. But she moved to Brisbane in January of this year, so was able to incorporate our conference into a trip back, thankfully. And she's a world expert in stereo electroencephalography. And I'm going to tell you a bit more about this later, but it's a new program that we have in Beaumont Hospital. So we thought it would be good to invite her to talk about that. And like I said, I'll explain a little bit more later, but it's studying how the signs and movements and things that happen in seizures relate to the electrical activity in the brain and where that's coming from. So it can be very challenging for us to try and figure out, and can be very important to figure out, well, where exactly in the brain is the epilepsy coming from. And so this is a way, and I'll show you later, about how we can find the source of that focus. And then that can then allow us to, within the epilepsy surgery program in Beaumont, to sometimes remove or burn the epilepsy focus and stop the seizures. And then a big part of our conference was a section on SUDEP, or sudden unexplained death in epilepsy. And we had Katie Young, the sister of Louise Young, give a incredible talk, powerful talk, a message to our attendees about Louise and about SUDEP and about how it affected their family. And I believe we'll hear more from the Young family later today. And this was as part of the John Lynch Memorial Talk. So Katie gave this John Lynch Memorial Talk. It's a new talk that we've introduced since last year to memorialise a neurologist who was working in Galway, John Lynch. I don't know if any of you knew him. Or is there anybody from Galway here? Nobody from Galway. So he was a neurologist with a special interest in epilepsy, who was my age and worked as a consultant in Galway from 2009 to about 2018, but unfortunately passed away from a brain tumour in 2019. But he had a real love for his patients, and we've introduced this talk since last year into our yearly meeting to remember him and also to bring patients and topics we wouldn't perhaps ordinarily bring into our meetings, which tend to be sometimes too academic, So we're delighted that Katie participated in the meeting last week. And then we had our keynote talk, or what we call the Kirker lecture, and that, remember, is John Kirker, who is Ireland's first epilepsy specialist. And we have our main yearly lecture at our conference, remembers him. And this was Professor Sam Latu, who is a world expert in SUDEP, or sudden unexplained death in epilepsy. And for those of you who aren't familiar with SUDEP, it's the most severe complication of epilepsy, and it's when, and although quite rare, again, too common, unfortunately, but it's where somebody with epilepsy dies from a seizure, often during the night. So something that, we really wanted to highlight this year, and something that we wanted to highlight both to professionals and nurses and to all of our membership. So Sam gave a fantastic talk on SUDEP from breathing failure to rescue, and he's doing ongoing research into SUDEP and trying to figure out why it happens, what we can do to prevent it or reduce the incidence of it. And he told us that there's a possible signs of an early decrease in SUDEP incidence. So far we didn't have any sign of that, but there are some early signs of perhaps an early decrease in the incidence of SUDEP, which would be great. It means we're making some headway with what we're doing. So, and he highlighted that it's apnea, or stopping breathing during a seizure, is actually quite common. Now thankfully the vast majority of that doesn't lead to SUDEP, but it's that respiratory arrest during or after a seizure that is the most common cause of SUDEP. And he highlighted that there's some research now that serotonin, which is a chemical in the brain, may play a possible role, and that the breathing control centers deep in the brain and structures called the amygdala and the brainstem probably have something to do with SUDEP and the seizure affecting them. And they're very hard areas for us to analyze or to investigate because they're deep in the brain. We can't see them on our EEG tests, or so there's a lot, hopefully, of research to come from Sam and others to try and figure out why it happens and try and figure out ways of stopping it. I just added this slide about the kind of ways that we know now of reducing the risk of SUDEP. And that is, it's more common in people who are actively having seizures. So, we want to actively treat and stop, particularly the generalized tonic-clonic seizures. Those are the seizures that are at highest risk for SUDEP. And there's data now that nocturnal supervision or a detection device, can reduce the risk. Of course, taking your medication is really, really important. So compliance with medication, not missing your tablets, is really important. And other things that, provoke seizures or bring them on or make them more likely to occur. We want to promote people looking after themselves, getting enough sleep, avoiding alcohol, taking their medications. That will reduce the risk of SUDEP. And, trying to promote effective treatment. So, we are aware that there are a lot of people with drug-resistant epilepsy. So, we want to move those people on as quickly as possible if they might be candidates for epilepsy surgery, because with epilepsy surgery we can stop the seizures and then reduce the risk of SUDEP. So we're often saying in our meetings, we really want to move forward quickly on getting this person through our surgical program because we realise they're a high risk for SUDEP. And we know that there's higher risks, like I said, with drug-resistant epilepsy, male patients for reasons we don't understand, and people with intellectual disability and nocturnal seizures. As I mentioned, the family of Louise Young are going to be here later, and we'll be talking later. And in the last part of our conference last week, we had a debate, and this is also kind of keyed in nicely with our topic of SUDEP because it was on wearables for epilepsy. And so the last couple of years, we've had a debate at our yearly conference where we'll have somebody argue for a somewhat controversial topic and somebody against, and we kind of take a vote at the end. And so for was Mary O'Regan, who's a paediatric neurologist in Crumlin, and she highlighted that, again, there's data that nocturnal observation reduces SUDEP risk. she highlighted that people want detection devices. So when people come to our clinics, they're requesting them, or they want them, or they want information on them. So it may allow then earlier intervention, and can also more accurately quantify seizures, including for clinical trials, which is a challenge for us. And then against, it's always hard to do the against when it's something that's kind of probably obviously is useful, but it's a way that we just kind of promote discussion about it. So against was Olivia O'Mahony, who's a paediatric neurologist from Cork University Hospital, and she highlighted that there's still limited or even no scientific evidence for these detection devices or wearables. So it's unclear if clinical outcomes have actually changed. Okay, we can perhaps pick up seizures, but does that change the outcome? We don't really know that yet because the studies haven't been done yet. And these detection devices, they're really only effective for bilateral tonic-clonic seizures. They're not, because they tend to pick up increases in heart rate or movement. So for a seizure where you're just zoning out, it's not going to pick that up. So there's a lot of false positives too. If you go to the gym, it's going to go off. And it'll also be positive for other kinds of seizures, like non-epileptic seizures, and they can be expensive as well. So we highlight what an ideal device would be, and I don't think we have one yet, but an ideal device would be, and we're going to hear a little bit more from Maeve about this later in the day as well, that there'll be real-time ongoing detection that will be accurate, that won't give you a lot of false positives, that will be attractive and low visibility, low intrusiveness, and so hopefully in the next couple of years we'll see that. And the official recommendation, how am I doing on time? Okay. Have I, 10 more minutes? Or?
No, you're over your time now.
Oh, I'm over time. Oh, okay. Well, let's skip that. I'll try and move on more quickly then. So, because I thought it was going to be under time, but I do want to highlight there's a couple of new drugs. Would I have 5 more minutes, maybe? 5 minutes? 2. Okay. So there are. Well, I'll highlight then 3 new drugs that are either available now or will be available. You've all been aware of the cannabis for epilepsy. Well, now we do have a pharmaceutical grade product that is available through the Irish system. Now, it is specifically, unfortunately, or fortunately as well, for Lennox-Gastaut syndrome, Dravet syndrome, or tuberous sclerosis. So other types of epilepsy, we're not able to use it, per the Department of Health, who are funding it. So what we have to do is we have to put somebody's information into an online portal, and through that online portal, then they will either approve it or not, and then it's dispensed to the pharmacy. But so we've been using this over the last couple of months with in these particular syndromes, good results, but we don't really have evidence from clinical trials that it's effective in other kinds of epilepsy, so we're generally not using it. And then we also currently don't have any product in the other cannabis program, the Medical Cannabis Access Program. There is no product in that we feel is safe and useful for epilepsy. So Epidiolex is at the moment the only cannabidiol, cannabis-based product that we are using for these types of epilepsy in Ireland at the moment. Xcopri, or I spelt it wrong there, apologies, or cenobamate, is a drug that's been out in the US for the last 3 years. It's available on an early access program here, and hopefully will be on the long-term illness scheme in the new year. But it seems to be really, really good. It's for focal epilepsy at the moment, over 18 years of age. And if you look here, one of the reasons why it's good is that 13% of patients on it get 100% seizure reduction. So it has a higher level of effectiveness than other drugs that we've been using. So not working in everyone, but we've had patients who've responded really well to it. So that's exciting for us and for patients. It is complicated, relatively complicated drugs. There's lots of interactions. We have to slowly titrate it up in case there's an allergic reaction. So, and the other drug that's on the horizon is Fintepla, or fenfluramine, and this is specifically we can only use in Dravet syndrome over 2 years of age, and in trials it was found to reduce convulsive seizures. The particular issue with this drug is that it had been used in adults at higher doses for obesity because it suppresses appetite and caused heart valve problems. So they haven't seen that at lower doses with epilepsy in kids, but there is an echocardiogram needs to be done every 6 months for a while after starting it. So this will hopefully come on board in the next few months. So yeah, looks like I'm out of time, I guess. So I was hoping to show you a little bit more and a little bit more about stereo EEG and about some diagnostic tests, but maybe we can do that another time. So, all right, thanks very much.